Hello, Gold viewers. I'm Fiona Langsharp, IBCLC and Public Relations Manager and MC for the Gold Midwifery Online Conference 2015. Well, welcome everybody. I have the pleasure of sitting down with Dr. Amy Gilliland today. Welcome, Amy. It's great to have you back with us.
Hi, Fiona, and I'm so excited about this conference.
Yes,
Thank you
me
for
too.
having me.
Yeah, I'm very excited too, and such great topics, including yours. And I'm just going to talk a little bit about that today. So it's from lovers to parents and back again, a time of shifting sexual identity. Wow, that is certainly a mouthful. So there's going to be lots of content. I've already had a quick sneak peek of looking at your presentation today, and I know that everyone's in for a very exciting ride with you, Amy, again. So perhaps you could tell me what first drew you to this specific topic?
Well, I think as a caring professionals, we are all kind of aware that sexuality is important in the lives of our clients and patients, but we are really shy about entering into that territory. It's like, I don't want to say the wrong thing. I don't know a whole lot. Um, so I want to help bridge that gap, that knowledge gap, and also as a culture, we have this real blind spot when it comes to birth. We just don't recognize how it affects so much of our lives afterwards, and how much what happens during the labor and the birth experience itself affects the later life, intimate life of a couple. We blame the baby whenever there's a problem. We blame the postpartum rather than realizing there's this hugely impactful experience, very intimate experience, very vulnerable experience, and how things that happen there, events, attitudes, how those are communicated to people, and how it shows up in their later life as a couple.
Yeah, and I feel like this topic just has not been given enough justice. I think it's something we somewhat skim over, and that's like I was saying to you earlier, I'm excited that you're talking about it and that we have this opportunity to really sort of, go into a deeper sense of really looking at it, what it's like. And so again, I'm excited for you to be sharing this topic with us. So would you say that, this really does have a significant importance for our families and for our healthcare providers in that postpartum period?
Oh yes, oh yes, and I think it actually goes on for years. But there's when we talk about this, when I think the fact that I'm a birth professional and a sexuality professional, I'm at this perfect intersection of being able to understand the different influences, because it's not just one thing. It's a whole matrix or coming together with a. It's almost like putting together a jigsaw puzzle. It's like. What were the attitudes of the care provider? Where did people have their labor and birth experience? What kind of procedures were done? It's multifaceted and it's complex, and it's going to be different for different people. But I think what midwives will be able to provide is a space for listening and an understanding. Once I go through, okay, here are the things that seem to really matter. This is what our research tells us matters, and these are some other here's the research, what it says, and then I think also what we kind of intuitively suspect as well matters, because we go to births as midwives and doulas and other perinatal professionals. That I'm hoping that people will leave with more confidence and a feeling of like, oh, all right, now I have an idea about what I could say or what topics to introduce in my postpartum group with parents. I think that just beginning to have the conversation and also listening, it's the key is always listening, isn't it, Fiona?
Absolutely, I agree. And you know, you touched on a word there. I think that even I'm looking for, I want more confidence. I think there's a yearning, you know, I want to know more about this topic. And I think that, you know, well, I know you will, but you're bringing it, and that's just great. So thank you so much, you know, for, again, identifying this as being such an important part, you know, of our families' lives. And I'm truly looking forward to hearing it in the presentation. And it's always a pleasure working with you, Amy. So thank you for being with us here today. We have run out of time for now, and I don't want to give away too much. And I'm looking forward to seeing everyone online and listening to this presentation as well. So thanks again, Amy, for being with me here today. And we'll talk to you all again soon. Thank you. Bye-bye.